All right, good morning. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana to Afya Clinic. This is where we get to learn about everything health. We talk about everything that concerns you, concerns your health, and make sure that we just talk about it in a way that you are able to understand. All right? So karibu sana. Thank you so much for being here. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And we're so glad to have you here. We say each and every other day that we do value your time greatly, and you choosing to watch MBCI is also an honor. We tell you that you are our guest of honor. Okay, so officially karibu sana. My name is Rachel Kahugo. We'll be here up to 10 in the AM, and from now to 10 we'll be having a conversation that will be very educative, and you know, it's something that we've talked about some other time, should be sometime last year, but I know it will be of great impact. So this is where you call your friends, your family, so that they get to also just, you know, get enlightened in our conversation today. But before we do that, we'd love to know how you've been. From last week on Wednesday, where we were here, we were talking about the immunization that was happening. And I hope ulipeleka mtoto wako. You know, the other time we said it's very important to make sure that your kid amepata the vaccines. It's better tunasemanga prevention is better than cure. Yeah, we said typhoid is not funny. Mtoto akipata hizi magonjwa, akipata measles, you know, you'd rather just get the vaccines as early as now rather than waiting mpaka kwenye itakuwa very chronic, maybe it goes to blindness or something like that, and then tuanza kusema we'd rather have done it earlier. So I hope you took the right precautions. If not, you can always go to the healthcare facilities na utapata usaidizi. But I'll not talk about that very much because we also have a doctor who's a pediatrician. He'll be shedding light about that kidogo tu tukimalizia kipindi ya leo. But for now, karibu sana. Tell us how you've been, where you're watching us from, unatuwatch na kina nani, and we'll be happy to hear from you. What are you thanking God for? Our numbers are very open for that. That is 0721 105 105 on WhatsApp, 23814 SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on all those social media pages we'll be happy to hear from you. Rachel Kahugo on all social media pages. Pia pale nitaweza kupata ujumbe wako loud and clear. Today we are talking about Mpox, monkeypox. Yeah, so you could have had one of those two names or both. So we'd love to know what that is. Inatoka wapi? Is it associated in any way with the monkeys? Because inaitwa monkeypox. I know last year we got so many questions on that. And why is it that we have to talk about it again now? Is it a public interest? Is there an outbreak? If you have any question around that, we have our doctors today with us, and they'll be able to shed light on the same. But just to get a bit of history of what Mpox is, we have a segment which is the In History segment. So let's get that, and then as we come back, I'll be introducing our guest to us.
Mpox, formerly known as monkeypox, is a viral disease caused by the monkeypox virus, part of the orthopox genus, which also includes the variola virus responsible for smallpox. It was first identified in laboratory monkeys in Denmark 1958, hence the name. The first human case was recorded in 1970 in the Democratic Republic of Congo, then Zaire, during intensified efforts to eradicate smallpox. Initially considered a rare zoonotic disease, Mpox was primarily confined to remote rainforest regions of Central and West Africa, where it spread from animals such as rodents to humans. For decades, human pox cases occurred sporadically, with occasional outbreaks mostly within Africa. In 2003, the first Mpox outbreak occurred outside of Africa in the United States, linked to imported African red prairie dogs. This event underscored the virus' potential for international spread. Despite being less contagious than smallpox and usually less severe, Mpox drew attention from health authorities due to its ability to jump between species and cause outbreaks with human-to-human transmission, particularly in close contact. A global outbreak in 2022 marked a major shift in the disease epidemiology. Mpox spread to countries without a history of the virus, primarily through close often sexual contact among networks. Mpox spread to countries without a history of the virus, primarily through close, often sexual contact among networks of men who have sex with men. The World Health Organization declared it a public health emergency of international concern in July 2022. Renamed Mpox in late 2022 to reduce stigma and racism associated with the old name, the virus has since been closely monitored by public health bodies worldwide. Improved access to smallpox vaccine and global awareness campaign have helped curb the outbreak, but Mpox remain a public health concern due to its potential for resurgence adaptation.
All right, so that is the history of Mpox, and I know we've used very medical terms there, but that's why we are having our doctors today with us. And today we have two guests on set with us. So that means if you have any question that you'd want to ask, we have the right people to answer you. Sawa sawa. And as we, I'll be introducing our guests to us, but even as we get into the conversation, we'd love to just let you know that this is where you get all the answers that you want about Mpox. So any question that you have, uliza kwa Kiswahili, uliza in English, we'll be able to answer you. And for that, our numbers are very open. As I said before, 0721-105-105 on WhatsApp, 23814 SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. On those two social media pages, ukienda pale kwenye comment section, I'll be able to get your feedback as well. But for now, so that we can now get started, I'd love for us to get the guest intro so that you'll just be able to understand in depth who we are having today in studio. Good morning and welcome to Afya Clinic, the space where we have real conversations about your health and well-being. Today, we are turning our attention to a growing public health concern, Mpox, formerly known as monkeypox, what it is, how it spreads, and why it matters now more than ever. To help us understand the current situation and the national response, we are joined by two distinguished professionals working at the heart of Kenya's health system. From Nakuru County, we have Mr. Moses Obiero, a manager at the Public Health Emergency Operations Center. He has been instrumental in surveillance, contact tracing, and community engagement in Mpox hotspots. Alongside him is Dr. Francis Nganga, a respected pediatrician and public health expert from the Ministry of Health in Nairobi. Dr. Nganga brings a national perspective on Mpox control and the prevention strategies across the country. Together, they'll help us break down the facts, dispel the myths, and empower you with the knowledge to stay alert and protected. Welcome to Afya Clinic. I'm your host, Kahogo Rachel. Perfect. Karibuni sana. And thank you so much for coming. Thank you for being here. We are happy to have you on MBCI TV. Yeah. So we say Afya Clinic is a family. Yeah. And I know we have people who've joined us today for the very first time. So maybe we just start with Afya Clinic is where we talk about everything health, literally everything that affects you. And for the fact that you're talking about Mpox today, inamaanisha Mpox inatu affect sisi as a people. And in Nakuru County, there's a training that's happening that you'll be telling us about. But before we get there, maybe we just start with a small introduction. I know you've done an intro already, but please say hi to the people, tell them who you are, wasikie sauti yako as we start. Yeah.
Yes, thank you very much. Ningependa ni wasalimu wananchi, habari zenu. Kwa majina mimi naitwa Moses Obiero, nafanya kazi katika hii county yetu ya Nakuru. Katika hii county kazi yangu haswa na manage ile kikosi kinaitwa Emergency Operations Center. Katika Emergency Operations Center kazi yetu haswa ni kufanya utafiti na kuangazia vile magonjwa yanasambaa katika county yetu. Na tukifanya hivyo tunatafuta zile njia ambazo tunaweza kukabiliana na hizi magonjwa ili tuweke mikakati sambamba na tuweze kufanya watu wetu wakuwe na maisha bora. Asante sana.
Asante. Now, kwa sababu umesema, so there's something you said that unaangalia vile magonjwa inasambaa.
Kabisa.
Which means you would know the numbers.
Naam.
There's a question ambayo tulikuwa tumuuliza na ningependa tu kuuliza tena. For you who's watching us today, have you seen anyone or do you know anyone who has Mpox? Because I know the reason why we're talking about it today is that it's now a concern in Nakuru and in Kenya. So what would you say about it? Is it increasing? Kuna watu sasa wanapata Mpox? Ama on a scale of 1 to 10, how is it in Nakuru?
Thank you very much, Madam Rachel. Actually, Mpox, we have had Mpox in Nakuru County since last year. And what's happened is that Nakuru somehow become a hotspot of Mpox. In other words, we reported like the highest number of cases in Kenya, so to say. But as a county, we were able to put in place the necessary measures, and we were able to actually mitigate the spread of Mpox. I would say that initially we were able to pick it mostly from the truck drivers and also our sex workers who probably were able to pick this infection from outside the country. Our truck drivers, by virtue of their business, you'll find that they move from Kenya towards Rwanda, Uganda, DRC Congo. And during that time, DRC Congo was actually the hotspot of Mpox, and it has been the hotspot of Mpox since 1950s, 1970s.
Okay.
So we had around 10 cases, and that was the highest in Kenya. But due to the necessary activities that we undertook, we were able to actually mitigate the spread, and we took some time before reporting another case. Until recently is when we reported some new cases. And from the look of things, from the data we have, because in my office, that is where we also manage the data concerning the outbreaks. We are seeing increase in terms of new cases. And I want to say that it's not only Nakuru. This is happening across the country. Like right now, we have over 90 cases that have been reported in Mombasa. Nakuru, currently, we have reported 21 cases. Busia has reported over 60 cases. And other counties are also coming on board in terms of reporting cases. So that means that this is a disease that has actually spread throughout the country. And from the look of things, again, as I said earlier, we used to see mostly truck drivers and sex workers getting infected. But currently, we have what we are calling community transmission. That means that even if you're not a truck driver, even if you're not a sex worker, everyone is now at risk. Yes.
Okay. We'll be getting to know how it's transmitted from one person to another, because as you've said, is that now we have people in the community who are getting Mpox. So that's something that we'll need to address. Daktari, karibu sana.
Thank you.
You well?
I'm very well.
Asante. How is Nairobi?
Nairobi is rather cold.
Cold.
I'm grateful.
Hey, this July weather, it's not funny. Please introduce yourself, say hi to the people.
Good morning, everyone. My name is Dr. Francis Nganga. I work for the Ministry of Health, the Division of Disease Surveillance and Response. I'm a pediatrician, but on top of that, I'm also a public health expert. At the Division of Disease Surveillance and Response, we coordinate surveillance activities, and we are responsible for responding to disease outbreaks throughout the country. So my role really in that division is coordinate surveillance activities across the country. But on top of that, as far as Mpox is concerned, the case management focal person, that is, I manage the case management pillar. And I'm really grateful to be here. Just to give Kenyan context. Currently, throughout the country, we have about 250 cases. And as Dr. here said, Mombasa is leading the pack with over 100 cases so far. And Mombasa is closely followed by Busia with over 60 cases, and Nakuru ranked third in 21 cases. And that is why currently we're here just trying to focus, to give targeted response activities, not only to Nakuru, but also we are also currently in Mombasa and Busia undertaking the same activity.
Okay, okay. Now, maybe let's just start with someone who's hearing the word Mpox for the very first time. Anashangaa mnaongelea nini? What is Mpox?
I think in the simplest of terms, Mpox is an infectious disease that is spread from one person to the other, and it's caused by what we call the Mpox virus. Previously, it was known as monkeypox, but we have had to change the terminology. But why it was called Mpox? Because it was first discovered in monkeys in 1958 in Denmark. So that's why the name Mpox was there. But Mpox is an infectious disease which is spread from currently one person to the other. And really it presents with a fever. Someone will have hotness of the body, and then they will start having the characteristic rash throughout the body. That's the simplest way I can be able to describe the disease.
Yes. And it's good you've given some of the symptoms, but Dr. Moses, what would you say are some of the very earliest symptoms of Mpox? Enye mtu akiona tu hivi, you need to go to hospital immediately.
Thank you very much, Rachel. Mpox, just like any other disease, presents with some characteristic symptoms and signs. But in the early stages of Mpox, you'll find that in most cases it presents with symptoms that actually mimics any other disease, even malaria. We have diseases like Marburg and the likes. So in the early stages, you'll find that somebody will present mostly with the fever. So fever is mostly the start of the disease. Of course, we have the asymptomatic disease. Asymptomatic stage where somebody undergoes what we call incubation period, which lasts like between 5 to 21 days. So after 21 days, if you are infected with these particular viruses that Dr. has talked about, the Mpox and the monkeypox virus, you will start experiencing fever. And another thing that you can also experience is body weaknesses, isi uchovu, mwili mechoka. Other symptoms would also include things to do with mwili kuchoka. I think I've talked about that. And secondly, after that, we call that prodrome period. After that, you'll get into the rash stage that Dr. has talked about. And rash will be characteristic. We have several rashes, like we also have things to do with scabies producing rashes or giving somebody symptoms of rashes. We also have smallpox and several other diseases that can cause rash. So there's a characteristic rash that probably would be distinctive from other rashes. That is why we are doing a lot of case management training, so that our staff, or rather our case managers, our doctors, are able to actually distinctively separate or pick these characteristic rashes that are specific to Mpox. Thank you.
You've mentioned something very important about the different kinds of rashes, because you've heard people saying, hata sijui kama ni Mpox, ama ni chicken pox, ama ni smallpox. How would you explain the difference between Mpox rash and the chicken pox rash or the smallpox? What's the difference? What stands out for the Mpox?
What really stands out for this disease is that one, that rash, the characteristic rash, it's usually at the same stage of development. That is, I don't want to really use the scientific term, but I think I'll be forced to. So when it's what we call papules, the whole body has that characteristic rash. Then it evolves to, it starts with macules, then papules the whole body at the same time. Then it goes to vesicles at the same time, and then what we call pustules at the same time.
Okay.
So it's very characteristic. And then another thing that is also outstanding is that the rash also affects the palms. And, yes, the palms and the soles of the fruit. So that's also very distinctive. But on top of that, there is also something we look out for, what we call lymph nodes. In most Mpox cases, the patient also has characteristic lymph nodes. That is swelling of the lymph nodes, especially around the neck region. So
zenye ziko kama tonsils.
Exactly.
Yeah.
Watu wengine wanazitanga ngai.
Mangai. Only Chinese.
Yes.
In Greek.
In Greek. So yeah, that is the characteristic.
Okay.
And if you compare it to something like, let's say, chickenpox, you see, like for chickenpox, if you have that rash, you have the rash is at different stages of development. Some are just emerging, others are healing.
Okay.
So, but for Mpox, the rash is at the same stage of development.
Okay.
Yes.
So what I'm getting is that for the Mpox, rashes is equal all over the body, yeah?
Yes.
Also, they all go from one stage to another all at the same time.
Yes.
Okay. But is that at the initial stages of infection? I'm a bit later because you've mentioned 21 days, the first 21 days where you can get fever and all that. So is also does the rashes come out at the initial stages, 21 days, or later?
So the 21 days that you have mentioned, it's called the incubation period. That is when the time between which you come into contact with the Mpox virus and the time you start developing the illness.
Okay.
So during that time, it's asymptomatic. You don't get to see or experience any effects of the disease.
Okay.
Then after those 21 days, or in between those 21 days, that's when you start experiencing the signs and symptoms. And it will start with the fever. Then after the fever, you get the rash.
Okay.
Yes.
Now, Doc, let's talk about how is this Mpox transmitted from one person to another. Yeah.
Asante sana. Mpox is transmitted mostly through contact. Yani,
so kiguza mtu mwenye yuko na Mpox.
Mtu mwenye ako nayo sana sana kama zile rashes zimeshaanza kutokelezea. Unaweza pata hiyo virus ambayo inasababisha Mpox ambayo tunaita monkeypox na uanze kukonjeka ugonjwa ya Mpox.
Okay.
Again, Mpox inaweza sambaa kupitia ngono. Sexual intercourse with somebody who is infected with Mpox. And looking at the data we have in Kenya and the surrounding countries, we find that in most cases the current transmission is through sexual intercourse and also through contact. Hiyo kutangamana na mtu ambaye labda ako nayo. Kuguzana kwa mili.
Okay. Okay. Is there a treatment?
We don't have specific treatment for Mpox, but we have what is called symptomatic management of cases. That means that if someone is presenting with fever, as we said, when you reach out to the hospital or visit a hospital, our doctors will be able to give you drugs that lowers the temperature so that your body is able to maintain the temperature. Other things that we do is that we manage the rash itself so that, of course, rash to some extent comes as a result of the infections. Probably you might also get secondary infections like bacterial infections. So we'll also give you drugs that will assist you so that you are protected against any entry of bacterial infection or makali ya bacterial infection yote ambayo huenda imetokelezea. So we do what is called symptomatic treatment. We don't really give you drug that will kill the virus. So the body itself will be able to develop antibodies that will fight against these viruses, and in the end, in most cases, we see people recovering. Mpox, when we take, for example, a number of people getting infected, you'll find that only a few will probably reach that stage where they need to be hospitalized. Most people, they just recover naturally through their natural immunity.
Okay.
No.
So that means it's easier it's easily treatable for someone who comes to hospital as early as they see the symptoms.
Exactly.
Okay.
That's a fact.
So,
and it's not only Mpox. All diseases, if you visit the facility, health facility early enough, we are able to actually give you drugs that are going to assist you. You know, drugs works when the body is also still very strong.
Yeah.
Yes.
Okay.
Exactly.
Okay. Now, how long typically does Mpox last in the body? How long does it take for one to, get well?
Yeah, so I'll take you through the various stages. So the first one we spoke about is the incubation period, where you don't have the characteristic rash of any signs and symptoms. This lasts from 5 to 21 days. Then we go to the next stage, which is known as the febrile stage, whereby someone starts experiencing the fever. It usually takes 1 to 4 days. Then after that, you start experiencing the characteristic rash, and this rash usually lasts from 2 to 4 weeks. Then the stages of recovery is days, from days to a few months, much later. So I just want to emphasize that one, someone is infectious. Someone can transmit the disease when a few days before the rash, that is when they start experiencing the fever, and then up to and until when all the rashes clear. That is the rashes usually fall off and new skin start forming. So until someone starts forming the new skin, they are very much infectious. And during this time, we emphasize that someone has to be isolated. And the isolation can either take place at a health facility or under the home-based isolation and care. And that will depend on the presentation of the patient. If the illness is severe, they have to be admitted in a health facility for management. For those who have the mild form of the disease, the healthcare worker will have to do an assessment, and it's the work of the healthcare worker to determine whether that patient will be managed at home or in a health facility.
Okay. Doc, I see there's a very interesting question here, and they're asking, is Mpox a deadly or a life-threatening disease? Is it?
Thank you very much. I like that question. For people who develop complicated Mpox disease, it becomes life-threatening. But for those who develop the mild disease, especially those who probably, the doctor has said, we normally say they be at home-based isolation and care. In most cases, they recover, and in most cases, in them, we don't see life-threatening disease. But for those who go to the hospital and develop complications, it is life-threatening. And again, you'll find that, as I said, the way the body's immunity is in terms of strength also determines how much the damage will be caused by the disease. So you'll find that those who are immunocompromised, like people who probably are infected by HIV and AIDS, it becomes so serious. It becomes a little bit a danger to them. Those who also have chronic diseases like cancer, also the immunity is compromised. So in such cases also the disease becomes a threat to them. Yes.
You've mentioned complications. What are these complications that could come with Mpox?
We have a number of complications, like, for example, you might find that the disease affects the eye to the extent that somebody even become blind.
Really? How's that related?
It's possible. It happens. Because it causes a lot of rashes, a lot of skin damage.
I see.
It can actually damage the cornea. And you can even become blind. Also, the effect of the Mpox on the skin can actually damage a lot of the skin, and probably even making somebody to require skin grafting and such like. Yes.
Okay.
So those are some of the complications, and we have a number.
Okay. All right. Perfect. Maybe before we get into more of the questions, and just to remind you is that we'll keep reading your questions and answering your questions, and for that we are very ready to receive your questions through our WhatsApp number, that is 0721 105 105. Our SMS code is absolutely free of charge, which is 23813. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. So ukienda pale nitaweza kupata ujumbe wako on the comment section. I'll be able to get your feedback, and on all social media pages at Rachel Kahugu, I'll be able to get your feedback as well. So before we get into reading some of the questions, you mentioned that we have a training that's ongoing right now for the medics in Nakuru. Tell us about the training.
Yes, as I mentioned, the 3 top counties that have the Mpox cases, we are working in close collaboration with the counties and the NASCOP team. That is the National AIDS and STI Control Program, just to reach out to the frontline healthcare workers. These frontline healthcare workers are the ones who are in direct contact, who come into the direct contact with the patient and are responsible for managing this patient.
Okay.
So the reason we have involved the NASCOP team, that is the AIDS Control Program team, is because we have noted that the disease is disproportionately affecting people living with HIV and HIV/AIDS. And of note is that so far in the country we have lost 5 people, unfortunately, and over 50% of the patients that have died have had HIV.
Okay.
So it's very, very important for us to target the frontline healthcare workers who come into contact with these patients.
Okay.
So we are targeting the healthcare workers. That is number 1. Number 2, we are also targeting the HIV testing counselors. So they have a separate class. And on top of that, we also training the community health workers out there so that they can be able to go to our communities, explain the disease to our communities out there, so that if someone has any signs and symptoms that could be attributed to Mpox, they are advised appropriately. So we are targeting the whole healthcare chain.
Yeah. Okay, asante sana. There's the issue of stigma that has arisen among the people with Mpox, or this topic about Mpox. What would you say about that?
Thank you very much. Mpox, when it came with stigma.
Yeah, a lot.
And it was a lot of stigma, especially the way it came in terms of transmission. In most cases, in the first initial stages, it was more of sexual transmission.
Yeah.
And in most cases, anything going sexual is very stigmatized. Another thing is about the kind of rash that it causes, which is so intense.
Yeah.
And if you see somebody with Mpox at the last stages of the rash, it also can cause a lot of stigma.
Okay.
So stigma has been there in the community, and we are saying that Mpox is not a disease of specific people. It's a disease that can affect anyone, and that means that each and every person is probably at risk, and therefore there's no need of stigmatizing somebody. If you have somebody who is probably affected, you'll find that this person needs you more at the time he or she is infected than even the time he's not infected. So we require a lot of support to these people, psychosocial support, and also material support, so that they are able to actually undergo this process, the process of this particular disease successfully.
Okay.
During the time somebody is sick, as has been mentioned, in most cases, if it's serious, we isolate this person. Even if it's not serious, we do home-based isolation. Yeah. So this person probably may not be able to do the normal duties through which he normally gets money and his daily living. Yeah. And therefore, he or she would depend so much on the people around him, relatives, and any other person. And therefore, we need not to stigmatize them. Instead, we support them so that they can undergo through this process very successfully and recover.
Okay.
Thank you.
Would you say isolation is one of the reasons why it would take a bit longer for a patient to recover?
Isolation does not make, or rather contribute...
Stigmatization, rather. Sorry.
It does not contribute to the time the person is going to take in terms of recovering, but contributes to stigma, as you said.
Okay.
Any disease that probably requires isolation is normally stigmatized in the face or in the eyes of the community.
Yeah.
Yes.
Okay.
So it happens.
Okay.
But we are saying that that is the time the sick person actually needs the neighbors and any other person who can support him as most.
Yeah.
Yes.
Okay. What does home-based isolation look like?
So it's one of the ways in which countries are managing these cases, especially where we have a lot of patients. We recognize that not everyone can be treated in the health facilities. The health facilities can be overwhelmed, and that is why we have home-based isolation and care protocols or guidelines. So how it's done is usually it's done by a healthcare worker who has to assess the home care setting or the environment in which a person who is infected can be managed from.
Okay.
So some of the things that we look out for is that the patient has to be stable. That is, the patient should not be severely ill.
Okay.
It should be that patient should have a space, or ideally a room where they can stay by themselves. On top of that, they should be having a caregiver who would be able to to assist him or her when they are in isolation. They should be able to fend for themselves. They should be able to feed. They should be able to bathe themselves. And then they should also be able to understand how this disease, how not to spread this disease to the other person. So if they don't meet any of that, then they should be admitted in a health facility. And also in that home setting, there should be no one at risk of severe infection. So I mean, if I'm infected with Mpox, in my home setting, there should be no children, there should be no pregnant woman, there should be no an elderly person, and also there should be no person living with comorbid illnesses like HIV or diabetes. So it's something that can be done in a proper setting. And in countries that have so many cases, this is what is being undertaken, and it's proved to be very effective.
It's working.
It's working. And a healthcare worker should be assigned to that case to be able to follow them up, and they should be able to be reached every day, and then the referral services should be available to them. That is, in case they develop any complication, it should be very easy to transport that patient from where they are staying
to the hospital. I see. Now it's 9 a.m. That means we have to take a very short break, but of course we'll be coming back after this break. If you have any question, feel free to ask. As we come back, we'll be coming back to answer your questions and continue with the conversation around Mpox. Usiende mbali.
MBCI Television, transforming lives.
Unasikia wengine wanasema mimi nataka mwenye ako na six pack. Unajua unakuta Mwangicho Mola ameumizana na machuma akitafuta six pack.
Majadiliano kabambe katika Biblia na maisha. Juma hili tutazungumzia nini? Jumuika nami Enaeli Mlenga na mwenzangu Mangicho Mola. Alhamisi hii saa 1:30 hadi saa 4 asubuhi. Papa hapa MBCI Radio na wakati huo huo MBCI TV. Barikiwa.
Founder wa TikTok, jina yake inaanza na letter Z. Anaitwa nani?
Hapo ni tricky bwana.
Anakaa kutoka wapi?
Kenya. Kenya.
Oh my God. Is the gift of the Holy Spirit? Nitajie tu 3 zenye unajua.
Unabii. Mtume.
Continue.
Mhubiri.
Unasikia wapi?
Funika, gubi gubi, nyamaza.
Go. Go.
Nitajie poetics book 3 zenye unajua za Biblia.
Songs of Solomon. We have Proverbs. Psalms.
Nikamilishie methali. Mtaka cha mvunguni.
Sharti iname.
Kichwa cha kuku.
Kichwa ya ng'ombe. Kichwa ya ng'ombe.
MBCI Television, transforming lives.
All right, we are back after that very short break. Thank you so much for staying. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is Afya Clinic, where we talk about everything health. And today we're talking about Mpox. We've had an amazing conversation as we started, very enlightening. And I hope that you've learned a thing or two. If you have any question, feel free to ask. And we've said that it's very important for us to talk about this because Nakuru has been ranked number 3 in Kenya. Yeah, in terms of the cases of Mpox. And I'm talking about Nakuru because, I mean, you're based in Nakuru, but you're watching us from Nairobi, you're watching us from Mombasa, you're watching us from wherever it is. It's very important for you to just have an understanding of what Mpox is. Mombasa has been ranked number 1, or rather the coastal regions, yeah. And then Busia, yes, and then Busia, and then Nakuru. Do you have any cases in Nairobi?
Yes, Nairobi has also reported cases.
Yeah.
So far we have 9 cases from Nairobi.
Okay.
Yeah.
Kitale is a side?
Yes.
Eldoret?
Actually, about 20 counties
20
have
counties is
reported
a lot.
Mpox cases.
Yeah.
So, yes.
Okay. So it's very important for you to just have an understanding of what Mpox is, how you'd be able to stay safe from Mpox. But even as you continue with this conversation, it's very important for us to unpack the myths and misconceptions that surround Mpox. If we'd be able to get it, yeah, let's get the mythbusters so that we'll see what are some of the myths that surround Mpox. So, the first myth that we have is that Mpox is always deadly. Dr. Moses, what do you have to say?
Asante sana. Kwa hiyo ningependa kusema kwamba Mpox is not always deadly.
Yeah.
If you seek treatment in time, you will be saved.
Okay. So it's not always deadly.
It's not always deadly.
Yeah, because I feel like this is one of the statements that's creating a lot of stigma around it. People don't want to talk about it. They think utapata Mpox and you're gone immediately. But as you've said, is that the people who've recovered from Mpox. So it's something that people are recovering from. Yeah. All right. The second one is that you can get Mpox just by walking near an infected person. What do you think?
No, you can't get Mpox just by walking near an infected person. We have explained the various ways in which the disease is transmitted, and walking near an infected person is not one of them.
Yeah.
Yes.
Yeah, you have to get contact.
You have to be in
person.
direct contact with
Yeah.
that with the person who is infected.
Okay.
Yes.
Maybe for someone who wasn't there while you were talking about some of the ways that Mpox is transmitted, apart from that, the contact, which is the other way that Mpox is transmitted, maybe just shed light on. There's someone who asked, is it like COVID?
So let me just say that as Dr. had explained, there are various ways in which this disease is transmitted.
Yeah.
And we can broadly classify it into two. We have the primary mode of transmission and the secondary mode of transmission. The primary mode of transmission is whereby someone gets the virus from an infected animal or when they come into contact with an infected product of an animal. And as it has been documented, initially the disease came from the animals, mostly the small mammals or the small rodents, squirrels and the likes. So that is the primary. For the secondary, there is that direct contact, whereby through sexual contact, through kissing, through hugging, you can transmit the illness. But there is also whereby when you touch a surface or when you come into a contact with some with a contaminated material or linen, so you can easily get the illness. The other way, and this is also on the secondary way of transmission, is a mother can transmit the disease to an unborn child. So there is that vertical transmission. Yes. So those are the other ways in which someone can get the illness. Yes.
I see. Okay. On to the third one is that Mpox is the same as chickenpox. What do you have to say about that?
Thank you very much. Mpox is not the same as chickenpox, but it can be confused with chickenpox, especially if you have not understood well how it presents. So Mpox is not the same as chickenpox. They are two distinct diseases. Yes.
All right. And the last one is that Mpox is a punishment from God for immoral behavior.
That is so untrue. It's not a punishment. It's an illness, just like any other illness. No one is punishing anything.
Yes. Okay. What are some of the other myths that you've had people saying as you've been, either treating or going through the surveillance of Mpox?
Thank you very much. Maybe I just add a little bit on that one. That is a punishment from God. I really liked that because it's not true. One thing that I think we need to understand as a people is that outbreaks will always come. By nature of how we interact with the environment, and by nature of what we call climate change, we normally get a lot of mutations, especially in the disease-causing organisms, especially viruses, to the point that at one point in time, a virus or a disease-causing organism that probably was not able to cause an outbreak can start causing an outbreak. Another thing, as Dr. has said, as we interact with some of these animals in the zoo, in the jungle, and what is coming out through research is that around 75% of the outbreaks we are seeing today are actually from the zoo, from the animals. Yes. Mpox is one of them. COVID-19 was also traced to animals. So the way we interact with the animals can actually make us contract an outbreak causing organism or virus, or for that matter any other germ that can actually cause an outbreak within the community or within the people or the community. That means that probably today we are dealing with Mpox, tomorrow we might be dealing with a different thing.
God forbid.
Yes, so it is not something that we should probably allude to some supernatural powers of it. It is the way we behave. And that is why we always advocate that as a people we need to change our behaviors. And funny enough, most of these outbreaks they can actually be averted or prevented by simple doable actions like proper sanitation. When we had COVID-19, people used to sanitize very fast, very nicely. People used to wash their hands. And that actually meant, rather helped us in terms of reducing other diseases, even the real diseases and what have you. if only we were able to stick to that. You have heard Daktari talk about transmission even through touching objects that probably had been infected by Mpox.
Yeah.
If we adhere to proper sanitation, we'll avoid that kind of a transmission.
Okay.
Issues to do with the linen contaminated. If we can only clean our linens in a proper way, we shall also be able to avoid or rather reduce transmission rates from linen to human being.
Okay.
So proper sanitation is one of the things that can actually assist us to avert some of these outbreaks and also change of behaviors. I mean, good practices when it comes to sexual behaviors and what have you.
Okay.
Yes, so when we talk about other myths, I think I've also heard a lot of myths that people take this disease, especially the way we used to say in the initial stages, that we were picking it mostly from the truck drivers. So people are saying that this is a disease of truck drivers and the sex workers.
Yeah.
And we are saying no. Anybody can actually get this disease because currently we even have what we call community transmission. Thank you.
Okay. Asante. I love that you've mentioned about hygiene because I see someone had asked how important is hygiene in preventing Mpox, because we saw a lot of that with COVID-19 where, as you've mentioned, people are really sanitizing, and I wonder why people stopped doing that. Well, of course we can't walk wearing masks daily. Maybe we should, I don't know, but the part of like walking with your sanitizer, always washing your hands, maybe tungeendelea hivyo tungekuwa pazuri sana as a country health wise. Yeah, maybe we should bring that back.
We should.
Yeah,
actually we should. And even with the Mpox, we are advocating for we are advocating for hand sanitization, we are advocating for hand wash, and in hotspot places, as a county, we are trying to ensure that there are hand wash facilities, bus parks, hotels, lodges. We should have these hand wash facilities, and also ensuring that our people get to understand the proper ways of ensuring that standard of sanitation is actually upheld, especially in the lodges and whatever. Yes. Maybe
ninaweka watu wengine kwa limelight, but during the time of COVID-19, we saw churches, hotels, even homes. They had hand washing facilities up nje, everywhere, literally. Nowadays, I think we have like 50% of them waliona tuko safe sasa. You can just come inside and wash your hands in the sink. Tuko sawa. But maybe we should go back there, it would be good. Yeah. What are some of the myths that you've seen in your day-to-day activities? Are there any myths that you've had around Mpox that you haven't talked about?
One thing I've heard is that there is no Mpox. It's just a lie.
I think I've also heard that. Yeah.
So just because someone has not seen a case, it doesn't mean we don't have the illness.
Yeah.
The disease is there. It's been transmitted now within our communities.
Yeah.
And we urge everyone to just take note and also institute preventive measures that we have just mentioned.
Okay.
Hand hygiene is very, very important.
Yeah.
Maintaining social distance is also very important.
Yeah.
And safe sexual practices.
Yeah. For those who are married.
For those who are married.
Yeah.
So,
yeah.
So that's what we are advocating for.
Okay.
So the illness is there.
Yeah.
Mpox is a disease.
Yeah.
And it's affecting our communities.
Okay. So I've taken my phone just to see something that it's more of like a small survey that we had done on social media. And we asked, have you seen or heard anyone that you know with Mpox? So we had 20% of the people saying yes, we have. Just 20%. We have 70% of the people saying no, we've not had. And then we have 10% wanauliza sasa Mpox nini? What are you saying? Isn't it gani? So I love what you said, that Mpox is there. We have 70% of people saying no, we've not seen it. But the fact that you haven't seen it doesn't mean that it's not there. I think, as you said, it's very important for people to take the preventive measures to make sure you're not exposing yourself to getting Mpox. I think, as we always say, prevention is better than cure. Yeah? Now, we're getting more of your questions, but there's something I had. See here, there's a very a question that I think we should. Okay, I will get it. But continue sending in your questions. We'll be able to get them. That is on WhatsApp 0721105105 23814 SMS code, which is absolutely free of charge. We have our WhatsApp, our YouTube, which are live. That is MBCI TV official, and of course on Facebook, that is MBCI TV. Ukienda pale, we'll be able to get your feedback. For the people who have Mpox, and you know they are on treatment and everything is going well, what is the role of their families or the community in supporting them or helping them to get well? What should the community do and the family?
Thank you very much. As we had alluded earlier, when somebody is sick with Mpox, in most cases we recommend isolation.
Yeah.
Either home-based isolation or hospital-based isolation, depending on how the healthcare worker has done their survey and seen correct for them, for the patient, good for the patient. So in such a scenario, Dr. has also talked about caregiving. We expect the relatives to give care to the patient.
Yeah.
And of course, during caregiving, the caregiver should also take precautions so that he or she is not infected by the disease.
What are these precautions?
The precautions are just the same things we've talked about. When you're touching the patient, you must use gloves where possible. And of course, for the isolation, we don't expect that close interaction. We don't expect close interaction between the caregiver and the patient. Probably the patient will be able to bathe on his own, is given food, and is able to eat on his own. And such like things. So probably things to do with washing the linen for this particular patient. And of course, we've also talked about the fact that linens are also possible transmission routes. So these linens must be handled in a hygienic way. We should not aerosolize them. Aerosolize, do you say in Kiswahili?
Okay. Because of the water.
Not only water, but the virus in it can actually escape and get in the air and you breathe it in.
Okay.
So we don't, advocate for aerosolization.
You're getting it, yeah?
Yes.
Yeah.
Sure. So we are supposed to take this linen very safely and soak them in disinfectant, and then after that you start washing.
Okay.
Another thing is that these patients also require food, so the caregivers need to give them food because probably they are not able to do their normal routines. Other things is that these patients require to be given medication. So a caregiver would be required to actually remind them that they're supposed to be taking their drugs in time. And also probably remind them on issues to do with keeping safe and also being able to transmit to others. Of course, the healthcare worker would have educated the patient in terms of transmission routes and also how he's supposed to behave. Other things include psychosocial support. As a sick person, the caregiver is supposed to actually help in terms of encouraging the sick person. So those are some of the roles that a caregiver or a close relative of a patient infected by Mpox is actually supposed to assist him.
Okay.
Thank you.
Okay, thank you so much for that. Now, there's a question here. Are there any long-term health effects after recovering from Mpox?
Fortunately, for the disease, most of the patients do recover.
Okay.
And they can all resume their daily activities normally.
Okay.
But for some who experience the severe or the complicated form of the illness, they might get long-term effects. And one of the characteristic long-term effects is the effect on the skin. Someone might actually get scarring, or they might get hypo or hyperpigmentation. That is skin color changes. Other things, as Dr. had mentioned, it can also affect the eye. Someone might actually end up losing their vision. And then there are others like some effects, especially when if they had pneumonia, they can subsequently have chest problems and those kind of things. But the good part is that most of the time a person is able to recover fully.
Okay.
The majority.
Okay. Okay. Perfect. I think that has been a very informative session and conversation around Mpox. And, you know, I'm thinking most of the questions that are here are questions that you've answered in the conversation. But I'd like to just make it clear that if you have any other question, we'll give numbers. And on that, you'll be able to ask your questions, do a follow-up. And maybe just on that, are there specific facilities that someone should go akiwa na any symptom ya Mpox, ama just go to the closest facility near you?
Thank you very much. In terms of getting help from a health service, we say that go to the nearest health facility. You will get help.
Okay.
Go to the nearest health facility, you will get help.
Okay.
We have trained a number of our healthcare workers, and even those who have not been taken through intensive training, we have sensitized them, and they are able to pick some of these cases or suspect, if not pick. So things that they are not able to manage, they will be able to, we have a network, so they will be able to transport or rather seek for further clarification from higher authorities or from other healthcare workers. In health, we don't work in isolation. In any case, we need to consult. We always consult. Like here, we have a pediatrician. I'm not a pediatrician. So anything that probably come to me, and I see that I need to refer this, or rather to get advice from the from the pediatrician, I will always get to him. So that is how we work in health. And that means that you don't need to look for a specific health facility or a specific doctor. Get the doctor or the healthcare worker who is closest to you. You will be able to manage what he's able to manage, if it's first aid or whatever the case it is, and get more advice or refer as appropriate.
Okay. Okay. Perfect. Now, today we're not talking about pediatric issues, but we'll just close on Mpox. Then we'll just ask one question. Please don't send more questions about pediatric issues. Very soon we'll be having a conversation about issues of like pediatric as a whole. But leo wacha tuongele mambo ya Mpox. Yeah. So what would be your parting shots on the whole conversation that you've had about Mpox?
So my parting shot is, as I had highlighted, Mpox is here with us as a country, and we are on top on trying to limit or stop the spread of the illness by ensuring that our community members are well educated on this. So we ensure that the country is able to prevent the spread of the illness, but on top of that, we are able to, as a government, we are able to detect, report, and respond appropriately to the outbreak as it occurs. But at the end of the day, we want to stop the spread of the illness. That's my parting shot.
Perfect. What would be your parting shot?
Thank you very much. I want just to build on what Dr. has said, that as a country and also as a county of Nakuru, we have actually put in place all the necessary measures to curb this disease and also to treat those probably who have been affected. And under the leadership of our governor, I think as a Nakuru Department of Health, we have been supported well enough. We have had our contingency plan, which currently is now being implemented in terms of the activities we propose to undertake in line with Mpox control and prevention. We also have line that probably any other person can call so that he or she seeks advice, especially when it comes to emergencies. So the line probably I'll be able to read it for the public. We have 0799 332. 32 032 032.
You can take it again.
I can take it again, please. 0799 032 032.
Okay.
Yes.
That's very easy.
It is very easy to remember.
Yeah.
Yes.
So if you need help, make sure you call.
Sure.
Yeah.
Thank you very much.
Okay. Perfect. Works well. Thank you so much for that particular session. We've had a lot of unpacking, and I'm sure that we've gotten to very well understand what Mpox is. So if you need any help, please feel free to call the number. We can all remember 0799 032 032. Yeah? So that's for people in Nakuru?
Exactly.
Okay. So for that, you'll be able to get the help that you need. Now we have one question for the pediatrics. Let's see it. So we've said today we're not talking about issues of babies. We'll be talking about that another time. But just to help this one person, because you said, hey, we're a family. Anasema mtoto wake yuko 4 years, yuko 15 kgs na hataki kukula kabisa. Afanye nini? 15 kgs is very little for a 4-year-old, yeah?
For 4 years, a quick calculation using the age should be around anything from 16 kilos.
Okay.
So 15 kgs is a little bit on the lower side.
Yeah.
So my advice would be, whenever we visit our health facilities, usually carry our MCH booklets. So the mother should visit the health facility with that booklet, so that we can observe the growth trends. We can be able to see whether the weight has stagnated, whether the weight is increasing, or it's decreasing, and from that we can be able to make informed decisions. So visiting the health facility with that book is very, very important. And at the end of the day, not only to her but to any mother or any caregiver, a child who is not feeding well should always visit the health facility.
What would be the issue of kids who just don't feed? Because I know some who just don't feed. They're not sick, but hawakuli too. What's the problem?
So we have to understand our babies. People feed differently. So the most important thing is just to understand how your child feeds. There are children who feed small bits by bits throughout the day. There are those who just want to feed once and they are good to go. So we have to understand our babies how they feed, and we have to adopt to their feeding pattern, not to our pattern. And then we ensure that we visit our health facility for growth monitoring. Yes.
Perfect. I think that has been a good conversation. Thank you so much for coming. Thank you for that particular session. I know that you've learned quite a lot, but then if you're there and you joined us probably a bit late, should be like 9, we just love to tell you that we've been live on Facebook, on YouTube, and so that means that you'd be able to get the whole conversation that we've had. But also we'll be having Brenda, who will be taking us through the whole conversation that we've had. Just pointers, a few pointers that will help you understand what have we been talking about since from morning, still morning, from 7:35. So we started by music. We had a few songs that I know to a good part and you enjoyed them. After that, we got into the conversation where we were talking about Mpox. So it would be very important for you to just get to understand what are some of the main pointers, what would be your take home, but also just share with us from the conversation that we've had, what is your take home? What have you learned today? Would love to hear from you. We've had Dr. Moses and Dr. Nganga. Thank you so much for being here. That has been a good conversation. Mkirudi pale county, mambo ya hospitalini, waambie tumewasalimia, and we are absolutely grateful for the work that you're doing for the country and, for Nakuru and the country as a whole. Asante sana for that.
Thank you.
Perfect. So that has been it. We'll now get to have the conversation with Brenda, where she will be telling us about some of the take-homes, or what is it that she has gotten from today's conversation. And as you said, is that also share with us. Tell us, what is that one particular thing that is your take-home today? Yeah? So talk to us, and we'll be happy to hear from you. Let's see some of the people that are already sharing, even as we get to Brenda. As we see Brenda, uko poa? Ko fiti? Ko happy? Very important. Okay, you'll be getting to see Brenda in a very short while. But let's see, what are some of the... For me, I would say one of my very main pointers, which would be like a parting shot for me, because hey, that would be Mpox is here with us. You know, I've realized most of the people would say, you know, sijana ino na kona Mpox, so why do we need to have that conversation? But it's that Mpox is here with us. You have people who are infected with Mpox, so it's very important for us to know tutafanya nini, ama what can we do to make sure that our people are safe and we are safe as well. Yeah, so also share with us what's your take home. Are we ready? Maybe you can use your mic. Okay, thank you very much. Yes, please have this. Thank you. Perfect. You're good?
Yeah, I'm good. How are you?
I'm okay. Thank you for asking.
I've learned a lot today about Mpox,
Okay.
especially the stigma that surrounds that particular disease.
Yeah.
And how are you, by the way?
I'm good. I'm good. I've learned so much as well. About the stigma, I think we need to change. Tunadidi kuchange hapo. Now we know so much about Mpox, so that means that we should eradicate the stigma that surrounds that. Perfect. Now take us through some of your pointers, some of your take-homes, so that people would learn as well.
Okay, so for today's pointers, I had a lot, but I had to summarize them so that we could get, I don't know if I invite to
Project them on the screen? Yeah. You still have people asking about, sasa hii home-based mmesema ni gani? So maybe just go through the home-based. I mean, it is the doctors who recommend home-based isolation, yeah? Right? So if you have someone who's not feeling well, please take them to hospital, and then it's the healthcare worker or the doctor who will recommend the home-based isolation. Ama inendaje?
Absolutely.
Yeah.
It's the healthcare worker who determines the kind of care that the patient will receive.
Yeah.
It's not up to the patient. Everyone who is suspected or has Mpox should visit a health facility.
Yeah.
Yes.
Because you're so used to self-treatment as Kenyans, and you think that really works against us.
Yes, it will work against us, especially in these outbreaks.
Yeah.
So it's very important for someone to visit the health facility and let the healthcare worker make that determination.
Yeah.
And we have a checklist that's used to determine whether you'll get home-based care or you'll undergo health facility-based isolation and care.
Okay.
Yes.
There's a checklist.
Yes.
Or what you mentioned about just to make sure there are no kids at home.
Yes. Those things I highlighted.
Okay.
We have a checklist for that.
Okay.
Yes.
So msijifanyie your checklist. It has to be from hospital. Kwa sababu my fellow Kenyans, let's take care of our health. It's very important. Perfect. Now let's go through some of the pointers that you have. Director, we're ready? Not yet? Okay. Sawa. So we'll be getting the pointers, but maybe we'd start with the Did You Know? Of course, you know the Did You Know segment is a segment where we get to jog our minds kidogo. We've had a whole conversation about Mpox, and that was very intense conversation where we learn and unlearn things like the myths. But just to get through that and let that sink in, we have this particular segment where we jog our minds and get the Did You Know from one and only Martin Mato. Wacha tuone sasa. Did you know yale inasema, did you know that an adult bladder can hold up to 400 milliliter of lipid? That's like almost half a liter. Yeah? Am I wrong? No? That's like almost half a liter. An adult bladder. I mean, isn't that like really small? Like expected it to be more. Okay, maybe you would know as doctors. Is that true?
Yes.
It's true. Shouldn't it be more? No?
Not really.
Okay. 400. I mean, 400 then is fine. 400 could be fine. Okay. So go and research more as well. In fact, what we'll do is that now that we've learned that, Nadoka may confirm that it is true. I don't know, I expected it to be more, but it's true. Now, I'd love for you to tell us something that you know that is very unique and yongetaka tujue. Like, did you know? But from your perspective, what is that you know that you think or you feel you should let us know and let other people know? Before we get the pointers, maybe we just get one from who? Did you know? Maybe you feel this is something that we should know. Doc? No? I know that's like... Manu, anything? Okay, we'll give you a week. Next week on Wednesday, let's have a did you know from you. So share with us and we'll be getting to share with the people. You have one, okay?
But I don't know if it has been said before. That did you know they breathe through their feet?
Through their what?
Feet.
Snails breathe through their feet.
Yeah.
Is that a thing? How would you breathe through your feet, surely?
That's what I found out.
Oh, really? That's very interesting. We'll go and research about that as well. We'll go and research about that. Yeah, that's very unique. Any? No? Okay. Perfect. So that is it on today. Thank you so much for tuning in. Thank you so much for staying. We're ready with the pointers and we'll be telling you a little bit about that. But thank you so much for being here. Now we'll be having Brenda and she'll be telling us more about what we have learned today. Brenda, karibu.
Thank you. It's been a while, it's been a minute.
Last week ulikuwa wapi? Do you want us to talk about that? No? Sawa. Yeah. Sawa, works well. Take us through the pointers.
Okay, so today's pointers. Number one pointer, symptoms for Mpox include fever, include rashes that spread even to the palms and toes. And we have general body weakness, which is mostly evident after 21 days. We have been told that the incubation stage lasts from day 5 to day 21. So after the 21 days, that's when we get to see the symptoms for it. And the symptoms we have seen that includes fever, rashes that even spread to the palms. And also, we have been told that Mpox is spread through the Mpox virus, right? The Mpox virus that can be spread from one person to another through direct contact.
Yeah.
And the next pointer we have is that the disease is spread through direct contact, as we have said, and with infected persons. That includes sexual intercourse or exchange of body fluids. For example, when the tuvimbe, it bursts or some person touches the person that is infected. That includes the kissing and the hugging. That is when we get to, you can be infected with the disease. And the next pointer we have is that the disease is managed by symptomatic treatment.
Yeah.
That is treating the symptoms that are being seen. That includes, if you have a fever, the fever is now what is treated. If you have general body weakness, if you have bacterial infections, that is what is being treated. And the next one is, there are 3 stages of the Mpox disease.
Yeah.
And then we have the first stage, which is the incubation stage, that lasts from day 5 to day 21. And there, we do not see the symptoms of the disease. We only see the disease now at the symptoms at the prodromal stage. That is kind of a hard term, but we are explaining it.
Yeah.
The prodromal stage, that is where we see now the weakness, the body symptoms. That includes the general body weakness, includes the characteristic rashes.
Yeah.
As we have said, that is just different from measles and other rashes because it spreads up to the soles of the feet or the palms of your hands.
Yeah.
And then we have the rash stage, that is the characteristic rash that we now see the rashes, and then the recovery stage. Yeah.
Oh.
And the last pointer we have today is an infected person has to be isolated for further spreading.
Yeah.
Yes. A person who has the disease has to be isolated from other persons because we have been told that it spreads through touch, like direct contact. It spreads through sharing the beddings. So that person has to be isolated either in hospital or at home. Yes, but we have been told at the same time we should not stigmatize those people.
Yeah.
Yes.
Okay.
That is what I had today.
Yeah.
I don't know if I've missed anything really.
Not really. Is there anything we've missed? Yeah. Ukisikia daktari amesema that is perfect. We're taking you in to be a healthcare workers.
I'm proud of myself.
Thank you. Thank you so much for that session. So that is what we got from today's conversation. Thank you so much for taking us through. So if there's anything you missed, it's there. But also we are still live on Facebook and YouTube, so you'd go through the whole conversation and I know that you'd get something. So it's very interesting. On the Did You Know, we have two people who've sent what they know and they want us to know. By the way, Victor, itabidi tuende tukaangalia. Anasema anaitwa Victor. Anasema, did you know that octopuses have 3 hearts? Oh yeah? Yeah. We have a producer anasema, yeah. It's supposed to be common knowledge. Yeah, anasema octopuses has 3 hearts. Thank you so much for that. We also have someone else who's saying that, did you know that music can physically affect your heartbeat? That your heart rate can sync with the music. Did you know? Is it even healthy? Wait. Is it even healthy? Anyway, so that is it on today's conversation. Thank you so much for coming once again. We've had an amazing conversation. Thank you so much for staying. I know that you've gotten something from today's conversation, and this is where we wind up. I know that you've been blessed today. We'll be having an amazing conversation again about health next week on Wednesday. If there's anything you'd want us to talk about that concerns your health, please feel free to share with us on our WhatsApp number, that is 0721 105 105. Others, thank you so much for staying. We do value your time greatly. We'll see you next week on Wednesday, but until then, God bless you. God be with you. Do not forget to go for the lunch hours right here at Kingdom Seekers Fellowship Nakuru, 12:30 to 2:30, and you'll be blessed. Okay? Bye-bye. Have an amazing rest of the day.